Welcome to episode 5 of my free 6-part video series regarding my revived pelvic floor core rehab. Are you interested in seeing the incredible transformations and recoveries from umbilical hernia, diastasis recti, weak pelvic floor, postpartum, C-sections, or anyone in between of this diagnosis? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be discussing amazing actual case studies of my revived pelvic floor core rehab. In the previous videos, I discussed the groundwork and demonstrated amazing program for you for free. From video 1, I discussed what is pelvic floor health, what is revived pelvic floor core rehab, and I also discussed on video 2, especially to how to do proper breath work to slowly connect with your pelvic floor to your lower abdominal areas, especially you have those complications post-pregnancy, postpartum. Video 3 are amazing progression as we discuss a lot of stretching, mobility, flexibility on a tight pelvic floor, on how to open that area when you're having stress incontinence, symphysis pubis pain that people endure, and SI joint dysfunctions as part of the pelvic floor health, the lumbopelvic hip complex that gets really weak and tight. You know how it goes after your delivery of your baby. There's no follow through and right resource for women. We always place in the back burner of all those doctors' offices. They just focus on the baby. But how can we take care of our baby if we're not taking care of ourselves first? We have to pour out more love in ourselves, take care of our health, so that when we take care of our health, we are 100% giving back to our community, especially to your babies. Our babies are our priority, but I know that we put 100% attention to our babies, but when you're having a lot of pain, discomfort, and weakness, how can you do that? Just watch some of my amazing testimonies. One of my students in New Jersey who has diastasis recti and umbilical hernia, she went through a lot of post complications on her last baby. She tried my program because she's desperate for need for help because she has that opening, and she tried my program. It's never too late to revive your abdominal core strength. And she was able to connect utilizing my pelvic core rehab. She was able to find relief and completed my program with confidence and be able to get back to her feet and be active and happy for her children. Everyone has a roadmap to recovery. And if you are someone who has this for many years, I just want to encourage you, it's not too late. So let's watch her testimony.
Tell the audience and how do you find my program and how you feel since you start. Yeah, it's recording now. This will be shown.
I just came to know about you through the YouTube channels because I had my umbilical hernia which was bothering me because of my postpartum. I had my baby, she's 6 months old, and after 6 months only I just came to know about my postpartum umbilical hernia. So that is when I just started searching for some YouTube videos and came to know about Annie, and I just started doing some YouTube videos and came to know about such as using her Instagram account. So I just thought I.
Oh, you found me through Instagram?
Yeah.
Oh, not through YouTube.
I just started using YouTube, but eventually I followed you in Instagram and signed through the.
Oh, through Instagram. Oh, that's nice.
Yeah.
Yes.
Yeah.
And
then what happened was, like, first initially I just started.
And you also I'm sorry to interrupt. You also have back pain, right? Like
I have because of holding my baby, I just had a severe back pain initially. An account of 10, I used to be like 5 at least. Daily I used to have severe back pain while holding the baby, or even while doing my household chores. I used to have severe back pain, and my posture also was had little bit of anterior pelvic tilt, which Annie, you just came to know about it with the help of the photos which I just sent you through the email. So I just came to know about my body a little more better after speaking to you. So after that, I just slowly progressed through all the videos, regularly, the week 1, week 2, week 3. So week 3, I had very good progress. First, it started slowly. Initially, it was very easy, but after second and third week, it started a little bit challenging for me, and my back pain started to reduce. Like drastically. I was able to feel the drastic reduce in back pain because of regularly doing the exercises and following her little tips and guidelines through the call. Also, you just made the weekly Zoom call, weekly calls. They just help me a lot, because I just able to tell you the progress, and the feedback helped me to progress even more better in a positive way. Yeah.
And then you also lost some weight, right?
Yeah.
How many pounds did you lose already?
I've already lost. I started with 65 kg, and now I'm around. I'm started with 75 kg.
Wow.
Yeah, and now I'm 69.2 to be exactly. Wow. Today morning I just.
And that's a nice way of losing weight, slow and surely every week, because this week is only your 6 to 7 week of our program.
Yeah. Yeah.
And that's how much you lost weight already.
Yes.
And so far you're getting stronger. You've been lifting your babies easier now, right? You have 2 children.
Yeah, I have 2 children, and one is 6 years old, another one is 8 months old. Now I'm able to lift her without any pain. Yeah. Good.
And before with Kiruba, she wears the abdominal binder, right? To support for her hernia. And now you don't need to wear it, right? Do you feel like you don't need?
No, I don't wear it now while lifting my baby. Initially, I used to, first the third week, fourth week, I used to wear my abdominal binder while just lifting her alone. But now, as my back pain has reduced, I'm not just wearing the binder.
Good. And how's the hernia? Is it getting softer? Is it pulling in now? How's the hernia looking?
The hernia over the week, it has become a lot more softer, and it just almost went inside. I'm not feeling any pain or any pressure around the hernia. The exercises are like very mild, and it's not like putting a lot of pressure over the hernia. So that is the part which I like the most, because safe and very effective, mild and effective. Yeah.
Yes. So, thank you.
Yeah.
And how do you find the program? Is it too hard? Is it how many minutes? It's only like 10-15 minutes a day, right? So it's not time consuming.
Yeah, that is the very easiest thing for me, because with the two kids, I hardly find time to do anything. But as the videos is like 10 to 15 minutes, I'm just able to split up my I can make it 10 minutes in the morning and evening 10 minutes. So 10 minutes, that time is like I'm just able to make up that time in my schedule actually. So 10 to 15 minutes is like very easy to do on a regular daily basis.
And so far, we are almost closing in with our program. Have you been reaching your goals since you joined the Back Masterclass?
Of course, yes. My main goal was to reduce a little bit of my postpartum weight and reduce the back pain as well. So, of course, I've almost achieved both of them. I'm just able to feel the progress. At least the weight also, I just reduced them 5 to 6 kgs, and back pain also has gone. So, of course, yes. Yeah.
I'm glad that you feel so good on your back. No more pain. You feel stronger and healthier. And I'm so proud of you, Kiruba. Now you're in the gym, lifting weights yet, starting to do the treadmill. And someday maybe you can slowly lift weights and safely and effectively. And that's something that I'm also creating, the Back Masterclass 2.0. Someday those who wants to lift weights safely. But right now, this is Back Masterclass 1. Those who are very beginners, right? Even advanced level, you feel like you're getting to that level for the flexibility, right? You're challenging. And it helps your posture, right? Your upper back.
Of course. First, when I started, you just started to take the pick. I'm just comparing the pick now. My body posture is completely like it's like tilted in the forward. Now I'm just with the help of some exercises, I'm just gaining confidence, and I'm just able to feel like I'm standing upright. Actually,
yes, I can see it even in the video right now, and I'm so proud. You dedicated. You progress well. You never miss all of the videos, and I'm glad you also joined the live stream, because we also have some live stream, and you did it well. Any more positive feedback on my back masterclass that you enjoyed with my program and you want to continue on, and because this is a lifetime access?
So for anyone with the back pain, or with at least struggling with the lifestyle of whatever they are going through, should definitely take this class, because that will help you from relieving your back pain, as well as you can just have one-to-one conversation and know more about your body, as well as what is going on within yourself, so that you can discuss, and every week the improvement you can just see just by yourself, as well as discussing with Annie. So I just highly recommend taking back masterclass for whomever, like having severe back pain, or need some posture, whatever related to the pain level, or the whatever related to the back thing. So this will definitely help them.
Thanks so much, Kiruba from Randolph, New Jersey. Thank you for trusting my program, and I really enjoyed working with you. I'm so impressed on your progress because you put the hard work as well. You dedicated, you listened through all my suggestions, and as we found the root of your problem, right? Once you finally know your posture and your even the weakness and how you change your lifestyle, it's really dramatically improved. And I'm so proud of you as we're slowly getting there to graduate soon. And as I said, lifetime access, you can always email me if you have any questions. And even through the program, I could give you any suggestion if you have any aches and pain in your chest or anywhere else. So I'm glad that it's being resolved fast.
I'm glad that I found you.
Thank you, Kiruba, for sharing sharing your testimony. And I'm hoping more people will find this relief, right?
Sure,
Thank you so much, Kiruba. So I'll see you on our next Zoom meeting call.
And another student, isn't that amazing? Revived pelvic floor health is not just for women. I know women suffer more because of pregnancy, and we have a hole that has more chances of weakness on that hammock-like structure. But guess what? Even men suffer because our rectum and that area go down too as we get older, and we want to revive it. It's not too late to revive, no matter what's your situation. Guess what? Finally could feel abdominal area closing there, as well as core muscles getting stronger. Walking a lot more every day now without any pain and discomfort on that area. And let's watch on his testimony.
I got viral this week only, and I'm getting from 1,000, I have almost 5,000 followers, like 4,000 followers in a week.
Oh, wow. That's exciting.
And they're all interested to do the Core Back Immersion therapy.
Very nice.
They put the post in the comment, I want to know, because they don't know those techniques, There's so many techniques out there, but it's hard to apply, right? Because you don't know where to start. You just don't want to just do frog pose and stretch. There's so much meaning behind that. In our program, we didn't just start frog pose.
Exactly.
I want to go to the level before you go to your hands and knees, right? When lying on your back, there's a step-by-step guide so that you feel confident on building strength. Because back pain is not just stretching.
Agree.
Now
it's a combination of stretching, strengthening, right? And what else? Stretching, strengthening, and there's something else, and stability, right?
Stability.
Yeah.
And that's most important. That's why there's a lot of people who never recovered just stretching, even though they went to physical therapy, because some therapists will just focus on stretching. Oh, yeah, back pain, that's stretch. Not realizing they're unstable sometimes. They do some core strengthening too, but I noticed there's a lot of physical therapists because sometimes I step in and they see results. Like my coworker can fix it, and then in a few sessions, they could feel a difference.
Oh, wow. You've got magic touch.
It's not just the touch, it's the techniques. The touch is just a bonus to feel good. You know what I mean? Because I didn't touch you, but you felt good. You felt the benefits, because it's the therapeutic exercises still, the benefits and the neuromuscular facilitation, when you facilitate through movement. And I'm glad you learned a lot in my program, because you've been in back pain for many years, right?
Yes, I've been.
And finally, you can connect to that side. You know which one is your side. Because of this program, you found out which one is your weaker side. And once you found the root of the problem, that I promise in my program, once you find the root of the problem, everything makes sense. When everything makes sense, it's easier to fix. Because if you don't understand why you're in pain, when you don't understand the root of the problem, you're all over the place. You stretch here, you stretch there. It doesn't work. Now you found out it's your glutes, right? Your SI joint on your left. And now you can stretch safely because you're more stable. And now you can continue hiking now with confidence. You can go in and out, you know, stepping in and out. The internal external rotation is still weak because it takes time to build strength. So now you know how to do it. You get sore building muscle, but you want to make sure not overdoing too. And you pace yourself too with your lifestyle. You started walking more every 30 minutes. You increase your protein intake. It's a lot of combination that you learn through my program.
Agree.
I'm glad you enjoyed my program, Fariha. I enjoyed working with you. And I'm glad that you love it so much, you want to continue, but unfortunately, it's not forever. It's like when I say goodbye to my patients who graduated, even in person, they don't want to get discharged. Because the pain is so little, there's no point for the insurance to keep paying, right?
Agree.
I just tell them, make sure you do your homework, because if you don't do your homework, you'll come back.
Yes, I think this is homework for life kind of a
For
thing,
life.
because
it's like your medication forever.
Yeah.
And the good news is you have unlimited access. You can always go back to podia.com, open, you have the link, and go back. If you have a little bit exacerbation, which could happen, example, you accidentally lifted 100 pounds. It could happen because I have patients who forgot about their pain. They lifted a couch with her husband, you know. They forget when you're not in pain, you know.
Yeah, I agree. Yeah.
And because 100 pounds is still too heavy, she had back pain again. It happens. So when you have back pain exacerbation, which could still happen when you accidentally did the wrong positioning, you know, go back to week 1.
Okay.
Unfortunately, pain will make you weak a little bit.
And some of the oblique moves, like after that, I feel so good. Like I've sat down for like a couple of hours. I'm like, oh, there's no pain. You know what I mean? But then it's there. It hasn't gone, but you know, like maybe the stretching feels good, or so
because when you
I
do
don't know,
contract, relax in that area, it's protecting you. And then when you exercise also, it has more blood flow, so the inflammation is lower. Anything that's prolonged sitting, standing, or too much walking, that causes the problem. That's why the program is only 15-20 minutes, unless once a week you do an hour. And I want you to continue with that if you want to be a little bit stronger.
So today I actually did your Strive day 27.
Oh, wow. How was it?
It was great. It was with the kettlebell and some weights. And I think it focused on plie squats and the lunges. And it felt good. Like there wasn't any time where, I mean, I feel definitely challenged, but I was able to finish all the reps.
That's good news. So see, when you join my program, you can't finish the Strive.
Yeah.
It gets harder.
I'm pretty close to
day 30 now. Day 30 has more challenge. It's a combination of a lot of things.
Isn't that amazing? Men and women suffer from weak pelvic floor. And this program works for everyone. I'm hoping you will join my class if you're a lady who just had a baby and you want to revive your pelvic floor health safely. If you have prolapse, back pain, SI dysfunctions, umbilical hernia, diastasis recti, I finally made this video, made this program just for you, and have that guidance hand by hand and fully heal your core and get that back in shape. And it's not too late. I've been through that as well with my pregnancy. I was bed rest for months. I was heavier. I gained 65 pounds. I had umbilical hernia and diastasis recti combination. And I also have symphysis pubis pain, which is a dysfunction on your symphysis pubis, which is the front of your area. So it's amazing how I get out of it, utilizing Pilates, yoga, and physical therapy. Sometimes I look back on what I went through as something I could utilize as a physical therapist. That's something that is hard to explain. You could read thousands of books about pelvic floor health, But if you don't experience it, how can you be a good teacher? And that's why I'm so excited to meet my new students on my upcoming Revive Pelvic Floor Health. And it's a healthy lifestyle choices that you could give back to yourself. And it's not too late to revive it if it's been many years or just recently. All the mamas out there, love yourself first. Love yourself so you can give back more love to your babies. And it's not being selfish. It's being a good mother. And I've been there. I took care of my health and I became a better mother. These stories are just a glimpse of what you're going to expect on my Revive Pelvic Floor Health. I can't wait to meet each one of you. If you have any questions, suggestions, or concerns, leave a comment down below or direct message me on my other social media and I'll try my best to answer each one of you. If you love my video and want to learn more about Pilates, yoga, physical therapy, health, and wellness, please subscribe to my channel. Ring the bell so you won't miss anything. Like and share this video. Every like you're giving to my channel, you are supporting me. So if you missed out my video 1, go back to video 1 first. Learn about Revive Pelvic Core Rehab first and learn the fundamentals, and then jumpstart your pelvic floor health, your core safely and effectively. Watch video 2. You're going to learn a lot about proper breathing. Until my next video training, always remember, be safe, be well, and healthy you. Bye!